Murkowski.
Thank you, Madam Chairman, and Mr. Secretaries, thank you for being here. Appreciate it. Important discussion here this morning. Many of my colleagues have touched on some of the issues that I wanted to raise, and so rather than try to repeat, let me go into a couple different areas. Obviously, this past year and a half, we have really learned the benefits of distance learning, how we're able to connect virtually. While it's not the ideal, I think we recognize that it has helped to facilitate learning, and particularly in some very remote areas. My state is one where we have many parts of the state that are either unserved or certainly underserved, and it has made distance learning very much a challenge. In certain areas, that underserved comes about because the cost for internet, the cost to deliver broadband to these communities is prohibitively expensive. You can have a family that's paying $800 a month to receive their services, their internet, and it's slow and it's cumbersome. It doesn't work for anyone. We have, I think, done a lot to address this inequity that we know exists within access to broadband. The bipartisan infrastructure bill is another great example of the work that we continue to do there, but we know that it's going to take time to build up this broadband capacity to connect communities and homes. The FCC has been working on a rule to allow schools to use their E-rate funded broadband to basically beam the instruction into students' homes. The FCC, as I understand it, has not yet finalized this rule. So to you, Secretary Cardona, are you working with the FCC to encourage them to get that work finalized? Do you know where we are in that? Because as they say, daylight's a-wasting.
You're right. Well, thank you, Senator, for bringing up the importance of making sure our rural communities also get the support that they need. This pandemic did impact rural communities greatly, and broadband access was really difficult to come by. And we've spoken about this, and I recognize the challenge that it is for students in your state to access learning online. Our agency is working with FCC to try to move the process along. I can have someone reach out to you with updates so that you have more up-to-date information.
I would appreciate that, because I'm getting those requests, and I don't have anything definitive to provide them at this point in time. Another concern that I'm hearing is, all right, we've got lots of money for tests, whether it is for the rapid tests, whether it is for the tests that you are able to get and take home. But having access to federal funding doesn't necessarily mean that you can find those tests. And I am hearing not only from schools, but I'm hearing from businesses that are worried about this mandate that's coming out of the administration that says either get vaccinated or do testing, but there's no place to get the testing, or certainly not to get the rapid test. So you've indicated in response to Senator Smith's question, Secretary Becerra, that we've got the tests out there, but it's difficult to get them distributed. I don't know whether that is just within the schools, but you need to know that right now there is a real crush to be able to get the testing that can get the results back in a timely enough manner to make a difference. Right now, you go into the Anchorage International Airport, where I get tested every time I land, and there are no rapid tests that are available. They say it's due to a national shortage, is the sign that they have posted. So where are we? How can we assure people that if you want the test, whether for work or for school, we can't just say we put lots of money out there. We need to know that it's actually getting out to folks.
Senator, and I think you'll agree that we've seen the surge in these last couple of months. Delta has really been the driver of all this.
Alaska's number one, and we don't want to be number one.
Yeah.
We are in a very, very, very challenged place right now.
And by the way, before I forget, I want to make sure that I mention that we're getting ready to move forward on telehealth rulemaking, and which might interest you as well. I know that
Okay.
broadband is an issue, but telehealth, we could talk about that later. But what I'll tell you in terms of testing is that FDA has moved forward to try to provide as many different type of testing opportunities as possible. I think it's now up to some 400 different types of tests that could be made available. We're trying to work closer with the industry, the manufacturing base, to make sure that they know what supply will be needed. We're trying to coordinate far better now with the states and local governments. We're trying to let the states help us determine where the test should go, rather than just let people in any part of the state or any part of the region of the country dictate where those tests should go, so we make sure there's always sufficient supply for every state. And so it's one of those things where we have to work in close partnership with our state and local teams to make sure that we're coordinating well, because in some places there's enough supply. In others, as you just mentioned, it's not. And so we have to make sure we coordinate very well.
Well, I think we recognize that we're going to be dealing with this, living with this, having this in our schools for a lot longer than any of us would like. And so the availability of tests and the affordability of tests and the quick turnaround of tests is going to have to be made a priority. Thank you, Madam Chair.
Thank you.